most important thing is that if you're ever feeling unsafe, and what I mean by that, like you feel like you're going to harm yourself or anything like that, call 000, call 13 11 14 Lifeline, reach out for support immediately. You know, we don't want a kind of temporary issue to become a permanent problem, right? Beyond that, then really it's about reinforcing the kind of connections you've already got. You know, one of the things that I say a lot to guys is that it's really important to create a connection with a GP. Not necessarily because you need anything now, but because when you do need something in the future, and it's inevitable that we all will at some point, you built a relationship with someone you trust. So it can be when you're in it, you know, concerned about your mental health, reaching out to your GP, going to a trusted friend and just saying, hey, I just need a bit of support. Within your family if you feel comfortable. Or there's a series of services out there who can support you, and one of them is MensLine. You know, give us a call. If you don't really know and you're unsure, that's totally fine. That's what we're here for. You know, we'll ask you questions, you'll give us information, we'll work on it together and we'll figure out what the next step is. Look, I think the first thing is that it's normal to have ups and downs in life. But what I always say to people is, you know, the ups should come down and the downs should go up. If that's not happening, probably something's not quite right. The second thing is that often people themselves are kind of the last people to notice something's really wrong. So if you've got, you know, family members who care about you saying, hey, I'm a bit worried about something's going on, or friends who are saying the same, open your ears and listen to that, because often it's a really important insight into how you're going at the moment. The most important thing, I think, is just being attuned to where you're at. You know, some of the most common things that can start to go wrong for people is that they start struggling to sleep. They're just not eating as well. They've lost energy that they otherwise have. And they're just noticing that their mood is all over the place. They're grumpier and angrier than they've been before. These are all these signs that something may be wrong. Doesn't mean that something is, but it might be. And I tell you, I'd rather, you know, take the chance about, you know, reaching out for support when something might be wrong than not doing that and wearing the consequences of it later. I think if you're feeling suicidal, the time to reach out for support is now. So you should never feel afraid if you're suicidal to call 000. Suicide is serious. You know, it's a serious emergency. We want to deal with it. If you have a local hospital nearby, go and reach their support. You know, call Lifeline 13 11 14 or MensLine. These are services that operate 24 hours a day. The things that make a difference in changing the situation when people feel suicidal, one of the main things I talk about is connection. Suicidality often comes when people are feeling disconnected from others. And it's amazing when you connect with someone, whether it be, you know, a counsellor on Lifeline or MensLine, a person at the local hospital, or just a friend who's come over, how much that can almost immediately change the way you're feeling. So the time is right now. If you're feeling unsafe, do it now. Look, if I'm living in a remote place, I understand I might not have a big mental health service around the corner or a big hospital I can go to. The first thing to say, obviously, 000 is Australia-wide, and so is Lifeline, so is MensLine. Call us if you can. But if you're struggling even with that, just going to see a friend, that next step rather than, you know, taking action around, you know, self-harm, but to go to a friend and connect with someone. Because when you're feeling suicidal, the quickest thing that we can do to change that is to have you around other people, connect you with someone. If you're feeling suicidal, regardless of what other people think about the reasons, I mean, suicide is serious. A really smart person once said, it's a permanent solution to often a temporary issue. You know, we want to avoid that, right? So it doesn't matter why or what the reasons may be or other people's perceptions. If you're feeling suicidal, it's absolutely integral to get help now, because we can change that. You know, we can work with people who are alive. We can't if they're not. You know, now's the time to intervene so we have that opportunity and chance to make a difference. Oftentimes people will reflect after they've got to a really bad moment in life that there were signs that things were building for a period of time. It can be hard as the person in the middle of that to see that happening, which is why we have to really practice being open to friends and family and other people around, and listening to what they're saying about that's occurring. Regardless if you're able to recognise it in the first time, the other thing is important that we all have signs and symptoms in ourselves that we're starting to build. That feeling that things are starting to crowd in on us, that our mood is getting out of control, we're more angry and we overreacted in a situation. These are the signs we should be attuned for. If they are, have a conversation with your friend. What do they reckon how you're going? Have a conversation with your family. And at the first step, what we want to be able to do is get you to healthcare early and discuss it. It's like anything, a pinch of prevention can make a big difference in terms of how things go over time. I understand this is can cause a bit of stress for people to think about. But what I would say is that the people on the other end of the phone, whether it be the responders at 000, counsellors and other services or mental health services, they've taken hundreds and thousands of these calls before. They'll ask you questions, and it's best you provide the best information possible because they're trying to, really shape the response to the best needs of the person that you're calling about. The most important message I'd like to give to people is that don't worry so much about whether you're going to get it wrong or not. Call up these services. They will help guide you about what you need. They'll ask you those relevant questions and take you through it. It's their job to figure that out. It's your job just to care about your person enough to make that call. This is really challenging for people, but the most important thing to communicate is that you can't help someone if you're not safe yourself. So the most important thing to recognise is that if you see that there's some potential harm, to make sure you're safe and to call the right authorities who can help you with that. Sometimes that is the police. They are trained to be able to help and be able to talk people down and to get safety back into a setting. So the most important thing, I would never recommend anyone try and intervene if someone had a weapon or some other type of safety. The most important thing is to maintain contact with the person, but call the right authorities and support who can help you. Yeah, it can be really complicated for people to figure out, where do I go for support? How am I going to access that? A lot of places have a long wait time or might be expensive and those things. I think the most important thing is that what we want to offer at places like MensLine, Lifeline or other sort of services, call us and we'll work with you around what might be available in your local area and the next best step. Most places in Australia will have some form of local area service or local mental health service who can help you describe for you what's available in your local community. You can reach out and gather that information. Other really important place you can go is your GP. They spend a lot of time working with lots of people who are accessing local services. But what I want to make sure people don't do is they don't give up because they think it's going to be hard. The most important thing is to go to these steps like the GP, your local health service, or call one of these services like MensLine, who will be able to help you find out where you find the best information, what supports are available and how you can connect with them. A social worker has done a degree in social work to understand the social impacts of different things. Social workers work across a variety of different things. Some work in mental health, some work in physical health settings, some work in community settings. And their role is really about supporting people with those social aspects of care to be able to get the help, the best pathway forward they need. Counsellors, have a certain degree of training, and psychologists often have a higher degree of training where they've done clinical specialisations to be able to provide different types of therapies. And psychiatrists are medical doctors who have specialised in issues relating to mental health. So each of these professions has a different role within the system to be able to provide care for people. And often the best way to figure out who's best for me is to speak to your GP. I think the most important thing is that we often get caught up on diagnosis a bit. Actually, what we're really interested in is, what are you experiencing and how is it affecting your life? So if you've got those things understood, go speak to your GP about it. Sure, there might be a diagnosis, it might be considered depression or anxiety, but those things are only useful in the context that they actually help guide what the next step is. Depression might benefit from a particular type of therapy and medication, anxiety maybe from something else. So it's an important thing for all of us is to recognise, we experience symptoms. What are they? What are the sort of things that are bothering us and are impacting our life in a way that we don't like? If we can recognise those things, go speak to a GP or a professional. They might be able to help you understand what that is, how that's the same as what someone else is experiencing, and what lessons we've learned about the best way to treat those so that you can experience that too. I think the first thing I'll say to anyone is that it's never the wrong time to reach out to care and to ask someone if they're okay. Never the wrong time. I think where people can get a bit confused is they feel like they need maybe some sort of training or language, or there's something special about this. But actually the most important thing is the relationship and the care that you have. So what I would encourage people to do is just to ask a simple question or point out something they've noticed. Hey, I noticed something happened the other day and something for me just wasn't quite right. I've known you a long time. Is everything okay? And I think the most important thing then is to stop talking and give the person space to open up. You know, they may not want to talk about it at the time, that's okay. But I've met so many people over the years who have said, who refuse to engage with their friend when they reach out, but then later will come back and say, it was so important that friend reached out to me and asked me at that time. It made me recognize something wasn't quite right, and then I went off on my own journey. So I just encourage everyone to do that. If you're feeling anxious about it, or you're a bit stressed about how to do it, call MensLine, have a chat. I really want to engage with a friend of mine, I don't know where to start. Trained professional counsellors have done this many times before with how to help you, guide you. But the most important thing and message I want to communicate is there's nothing ever wrong with asking someone how they're doing. I think one of the challenges we have in our society is that we want to fix problems. Like when you care about someone who you know is struggling, you want to be able to fix it, right? That's the thing you do. But oftentimes these problems have occurred not necessarily because of a discrete issue, but things happening over a long period of time, or things that there isn't an easy fix. And actually just being present and listening to someone and providing them the opportunity to express out the things that are bothering them is making a huge difference to them, a massive difference. It may feel like you're doing not much, just being present and listening, but you're actually doing a huge thing for a lot of people because we don't have that many opportunities in society to do that these days. So I just, reinforce to everyone, the most important thing is just to be there with people. If people are opening up, that's great. But at the same time, even if they're not, just being present and spending time is therapy in itself. We're incredibly social animals. We really, really want to connect with other people, and it's actually really important for our physical and mental health that we do. Our society is driving us to become more isolated and more lonely. Our life is lived online. We're not connecting the same way that we used to. We're working longer hours than we've ever done before. Support networks are vital, and they're vital not just for you if you might be struggling, but they're also vital for other people, for you to reach out and help them too. We can mutually help each other with this process, but sometimes it takes someone to lead. So my kind of call to action for all men out there is to take that first step. Be the instigator of the catch up and the connection with your social network, because it can make a huge difference for not only you or that person, but their entire community too. I think anything that helps men connect and to understand each other and where they're at and to provide an opportunity to process what's going on is good. For some men, that's about being able to talk and share and have the forum to do that. And we all have friends who are like that. But we also all have friends who are quiet friends too, who prefer to do things with other people, and that's the way they like to process. I think to be a good friend, to be a good member of our community as a man today, one of the things we need to do is recognise all of those different strengths in the way people are, and to do whatever we can to contribute to other people in those ways. So if you've got a quiet friend who likes to do things, reach out and organise a catch up to do things. If you've got a friend who really needs to talk, absolutely engage with that too. The more we can all take on that responsibility to do that, the better society we'll have.